The World Health Organization defines health as a complete physical, mental and social well-being and not merely the absence of disease and infirmity. A variety of definitions have been used for different purposes over time. Health can be promoted by encouraging healthful activities, such as regular physical exercise and adequate sleep. The meaning of health has evolved over time. Early definitions focused on the theme of the body's ability to function. In 1948, the World Health Organization proposed a definition that aimed higher. This was in terms of physical, mental, and social well-being, and not merely the absence of these. The WHO played a leading role when it fostered the development of the health promotion movement in the 1980s. This brought in a new conception of health, not as a state, but in terms of resiliency. Mental, intellectual, emotional and social health referred to a person's ability to handle stress, acquire skills and maintain relationships. Healthy People 2020 gives more prominence to health promotion and preventive approaches. A new expanded digital interface facilitates use and dissemination rather than bulky printed books. The impact of these changes to healthy people will be determined in the coming years. It adds a substantive focus on the importance of addressing social determinants of health. The term is also used to refer to many types of non-living organizations and their impacts for the benefit of humans. Healthcare or healthcare is the improvement of health via the prevention, diagnosis, treatment, amelioration or cure of disease, illness, injury, and other physical and mental impairments in people. It includes work done in providing primary care, secondary care, and tertiary care, as well as in public health. Primary care is the first point of contact and principal point of continuing care for patients within a healthcare system. Patients commonly receive primary care from professionals such as a primary care physician or family physician. Depending on the nature of the health condition, patients may then be referred for secondary or tertiary care. Acute care is necessary treatment for a short period of time for a brief but serious illness, injury, or other health condition. This care is often found in a hospital emergency department. Secondary care includes skilled attendance during childbirth, intensive care, and medical imaging services. Some secondary care providers do not necessarily work in hospitals. Patients that need sophisticated medical investigation and treatment are referred to a facility with those resources, such as a tertiary referral hospital, using the phrase tertiary care. Services in tertiary care include neonatology, neurosurgery, heart surgery, plastic surgery, cancer management, and treatment for serious burns. Quaternary care is the name for highly skilled, in-demand, and advanced degrees of medical care. This area includes experimental medicine and certain unique diagnostic or surgical techniques. Only a small number of regional or national healthcare facilities typically provide these services. Many types of healthcare interventions are delivered outside of health facilities. These include food safety surveillance and needle exchange programs for the prevention of transmissible diseases. Community rehabilitation services can assist with mobility and independence after the loss of limbs or other physical or mental impairments. In the US, healthcare ratings are increasingly used to try to drive accountability among healthcare providers. Data is often lacking with which to generate ratings. People may have difficulty finding the ratings, especially if they are negative and are often labeled as bad. Healthcare ratings are rankings or assessments used to gauge the effectiveness of systems and processes. This assessment of quality is based on metrics for patient satisfaction, safety, efficiency, access, availability, cost, training, equipment, staffing, and many other criteria. Hospital quality, health plan quality, physician quality, quality for other health professionals, patient experience. A health system is an organization that delivers healthcare services to meet the needs of target populations. There are as many health systems around the world as there are nations. Healthcare planning is often evolutionary rather than revolutionary, according to Dr. Richard Branson and others. The healthcare industry provides goods and services to treat patients with curative, preventive, rehabilitative, and palliative care. The modern healthcare industry includes three essential branches, which are services, products, and finance. It depends on the interdisciplinary teams of trained professionals and paraprofessionals. Health economics is a branch of economics concerned with issues related to efficiency, effectiveness, value, and behavior in the production and consumption of health and healthcare. In broad terms, health economists study the functioning of healthcare systems and health-affecting behaviors such as smoking, diabetes, and obesity. Health law is a branch of the law that deals with the laws that apply to providers, payers, and vendors to the healthcare sector and its clients. With a focus on patient care, it emphasizes operational, regulatory, and transactional challenges. The art of preventing disease, extending life, and promoting health is what public health is defined as. The idea of health considers mental, emotional, and social well-being. The foundation of public health is the examination of a population's health determinants and dangers. Environmental health is the branch of public health concerned with all aspects of the natural and built environment affecting human health. Health education is a profession that aims to improve people's health and well-being. Areas covered include environmental health, physical health, social health, emotional health, intellectual health, spiritual health, sexual and reproductive health. Health effects are changes in health resulting from exposure to a source. Health effects are an important consideration in many areas, such as hygiene, pollution studies, occupational safety and health sciences in general. A branch of psychology concerned with understanding how biology, behavior, and social context influence health. Mental health encompasses emotional, psychological, and social well-being, influencing cognition, perception, and behavior. It likewise determines how an individual handles stress, interpersonal relationships, and decision-making. Sexual and reproductive health, SRH, is a field of research, healthcare, and social activism that explores the health of an individual's reproductive system and sexual well-being during all stages of their life.